Hi, I'm Dr. Ann Korkidakis. I'm a reproductive endocrinologist and infertility specialist at Boston IVF. I see patients out of the Waltham, Worcester, and Springfield offices. Today we'll be speaking a little bit about ovarian reserve testing. There are two characteristics to eggs. One is the quality. That's directly related to reproductive age, and there's no test for that. The other aspect is the quantity, how many eggs an individual has left. Essentially, every month, individuals make a cohort of eggs, one is ovulated, and the rest of that cohort dies off. That's how you run through so many eggs up until the average age of menopause of 51 years old. We perform some serologic testing as well as an ultrasound to help ascertain some aspects of ovarian reserve. The serology or the blood testing is performed on cycle day 2, 3, or 4 in individuals that have regular menstrual cycles. Cycle day 1 being the first day of full menstrual flow. In individuals without regular menstrual cycles, these tests can be performed at any time of the month. We perform testing for follicle-stimulating hormone, or FSH. This hormone is important in the recruitment, development, and maturation of eggs. In individuals with a lower egg reserve, the signal has to get stronger. Therefore, values above 10 to 12 on persistent tests is suggestive of a more diminished ovarian reserve. We also use a hormone called anti-Müllerian hormone, produced by the small follicles in the ovary. The higher the value, the better. Values less than 1 are also suggestive of a more diminished ovarian reserve. We use an ultrasound to help ascertain whether these values are accurate. We do an antral follicle count to be able to have an idea of how many follicles you're making in a given menstrual cycle. That also helps us interpret your ovarian reserve. Interestingly, studies have shown that individuals with a low egg count can still have very successful IVF cycles. It does suggest, however, that you might need more than one cycle to be able to obtain your family building goals. Once all this testing is complete, it'd be important to meet with your doctor to interpret and understand what these values mean for you and to develop your own personalized treatment plan. We'll be there every step of the way on your family building journey. Please reach out and contact us to schedule an initial consult.